state and local leaders are working right now to find the best and safest way to reopen the region and kickstart the economy amid this COVID-19 outbreak. Joining us on the broadcast now to talk more about his efforts to help those in our area is New York State Senator George Borrello. Senator Borrello, great to have you with us today, sir. Thank you.
It's good to be back, Justin. Thanks for having me.
Well, last week, Governor Andrew Cuomo announced that he will be going with a plan similar to what you and Assemblyman Andy Goodell pushed to reopen the region. Can you tell us about what your plan entailed?
Well, we put our plan out back on April 15th, so 2 weeks ago, and we sent it to the governor's commissioner of tax and finance, and as well as put out a lot of publicity on it so people understood what we were trying to accomplish. And first and foremost, no one is suggesting that we just flip the switch and go back to the way things were before. The plan that we are calling for, number one, breaks down the state by the 10 economic development zones that already pre-exist. But most importantly, we have asked that businesses create standards to ensure that they are still meeting social distancing guidelines. Ensuring that they're equipping themselves with PPE and sanitizing areas, common areas, all those things. So for those people that think we're putting people at risk, this is not the case. Secondly, when you look at, it's not just region by region, but it's also industry by industry that we break these things down. There are low-risk industries, low-risk businesses, low-risk situations where you can safely and responsibly open and minimize risk. So, for example, there is concern, and one of the things we have to address now is the concern of kind of lumping us in with Erie County and Buffalo. And the reason for that is, there's this concern that people may come down to Chautauqua County or Cattaraugus County from Buffalo if those areas reopen. Well, what we're looking to start with is things like manufacturing. And so there's no there's no audience for someone building an engine at Cummins. As much as I've been there and I know it's really cool to watch, we're not going to bring spectators down to watch manufacturers. So certainly, that's why I think that this plan.
Yeah, and it's certainly, I know locally officials are very optimistic about reopening, and I know community members have reached out to us who, they're at home or working remotely, and they really just want things in the community to become more available. Now, I spoke to your successor, County Executive P.J. Wendell, about the role and really the opportunity we have locally to build a good model to reopen. Here's what Executive Wendell had to say.
I really believe that this is going to be a chance for Western New York, Chautauqua County in particular, to show the rest of the state what we're made of. This will be our finest hour, I'd like to think, and that's what I'm going to encourage our businesses to do.
Now, in regard to that, Senator Borrello, what's the responsibility and really this opportunity that we have to build this reopening model?
Well, and that sentiment is shared not only by County Executive Wendell and myself and others, but even a similar thing was said by Lieutenant Governor Kathy Hochul when she looks at the reopening of Western New York in general, which she has been charged with heading up. And that is, since we have a low rate of infection, since we have a very, very, very low rate of active cases, since we have critical businesses that are already operating, and we can be a model as to how we expand that. Right now we have to go from thinking of things as essential and non-essential, and going to risk factors. Who is at lowest risk? And again, it's the best way to do that. And, ultimately that can be a template for others. And as of right now, folks are already going out. They're going to big box stores like Walmart and Home Depot. And the risk there is based on, what type of PPE and what types of precautions are people taking, including the people that operate those places. So to look at having Home Depot open and not, a local business, a local greenhouse that can provide the same products, it's just fundamentally unfair, and the risk factor doesn't change. So I think we have to start looking at things in that light also.
Now, as for the plan specifics, the governor really hasn't released too much information. And as we mentioned here earlier on the broadcast, Congressman Reed is urging the state to keep in mind the differences between Western New York and the different areas within it. How much of a factor do you think that will play into the reopening process? Or does it seem like Lieutenant Governor Hochul is sort of thinking as a regional mindset? Have you spoke to her?
I have. I spoke to her recently, expressed the same concerns that Congressman Reed has, and not only that, but the outline of the plan that we sent, which we also sent a copy to her as well, calls out the fact that even though we're splitting things up regionally, that within those regions there are areas that need to be treated differently, especially those regions that have large metropolitan areas like Buffalo. That includes Western New York, and we called out specifically areas like Rochester and Albany, that have high population densities. So that was already part of our plan to begin with. So now some of the concerns, the challenges I think we face is the restrictions the governor is placing. For example, on contact tracing, which is determining once someone is tested positive, then how do we contact all those people they have been in contact with since they were contagious? Well, the governor said we need 30 contact tracers, people that are doing that job of tracing for every 100,000 population. Now that might make sense in downstate in a county like Rockland, where that would certainly be a good number of people. But here in Chautauqua County, that standard means 7 contact tracers for every 1 positive case. That just makes no sense. It's overkill, it's costly, and it's inefficient. So I think that standard needs to be changed, and again, needs to be taken into consideration not just population density, but also the rate of infection.
What type of timeline would you like to see for our area to reopen? I know there are a lot of people who are on both sides of the spectrum where, no, let's take this slow, do it in phases. And on this flip side, there's people who say, if my business doesn't open up tomorrow, I'm going to have some serious problems.
Yeah. Well, I think it needs to be deliberate and careful. And again, we need to take the same precautions as we are doing now. We are saying we're not saying go back to, as I said, not go back to the way things were before, but how things have to be managed now. In the situation, that means that we're still going to protect people as if there is still the same, the chance of infection. So that being said, I think we can move forward, as soon as possible. As I drove to my Jamestown office today, okay, I drove by the roundabout at Route 60 and 20 in Fredonia. And there I witnessed literally none of the construction workers wearing any PPE and literally standing right next to each other, as is required in an outdoor situation where you have 2 people working on, whatever particular part of the project they're working on. So how is that okay, and not, another construction project? The only difference being that it is a publicly financed construction project versus one that's not publicly financed. Same thing with the wind turbine projects, which have still not been shut down, which, by the way, are out-of-town companies employing out-of-town workers, out-of-state workers. How is that safe? So what I'm asking for is consistency. So I know there's people out there that are frightened and that they want to keep things shut down, but the reality is we are not shut down. And those same construction workers on the roundabout at Fredonia, when they go on their break, are going to walk into McDonald's and Tim Hortons and Burger King. And what risk of exposure are they getting, and are they in turn transmitting without those proper safety precautions? So I'm calling on the governor to ensure that the publicly financed projects are following the same executive order guidelines as those that he's imposed that have been devastating on our local manufacturers and our local small businesses.
And after we get back to what some are calling could be a new normal, what do you think that life would look like? More cautions, I would imagine, where people are saying, okay, if I'm going to the grocery store, if I'm working near strangers, so to speak, I'm going to have masks on, and office spaces, installing dividers. What does the next year, the next 2 years look like to you?
Well, of course, this is changing on a daily basis. There was an announcement this morning that company Gilead has had some success in their initial human trials with a treatment. So, what it looks like today and what we project out for a year from now may look drastically different, even tomorrow. So it's hard to say what the next year is going to look like. But again, I will say what I said before. Until we see a fundamental change in the treatments that are available, we will continue to keep people safe in the same manner and that we're doing now. And then more importantly, in a more deliberate way, what you're seeing now at grocery stores and restaurants that are doing takeout and those particular businesses that have been deemed essential, those standards and practices need to continue, but they should be expanded and broadened so that our economy can restart. And I think there's another important thing here, because I've heard criticisms from folks saying that this is all about money and you're willing to put people at risk for money. And that's just only one part of the equation. Just since April 1st in Chautauqua County, we've seen a spike in drug overdoses. We've seen a 75% increase in domestic violence calls. We've seen more than a doubling of mental health crisis calls that our law enforcement officials are handling. And as this continues, we are going to see increases in homelessness. You're going to see increases in poverty. You're going to see increases in other deadly diseases that always come along anytime you have a severe economic downturn. So this is about public health as well as our economy. And restarting in a safe and prudent manner is absolutely essential, not only to the economic survival of our families and our communities, but also to the human health aspect.
And in regards to that human health aspect, what do you want the community to know as we continue to move forward through this time? What's the messages for the families and for the residents of Chautauqua and Cattaraugus County and really the whole district?
The message is really this, that we will get through this, and that throughout this, we have seen, so much of the best in people who themselves are struggling, but yet that are taking their time to help others, whether it's sewing homemade masks for people, whether it's donating food to people that desperately need it, or just doing what we can to make sure that our friends and family members, are well and getting what they need. So continue to do that, and we will get through this sooner than later. And I would also ask those folks that are hesitant about restarting our economy to please look at the situation out there right now, understanding that if we can do this safely and responsibly, which is what we're calling for, that we need to start moving in that direction because not only is it about the here and now, but it's about the future. It's the future for your children, your grandchildren, and racking up all of this public debt while destroying businesses in the process is going to have an impact for what could be decades to come if we don't start getting our arms around this now.
All right, State Senator George Borrello. Sir, thank you for joining us today. We appreciate it.
My pleasure. Thank you.